Okay, upper GI. We're going to continue on with stomach cancer. So this is characterized by ulcerating lesion or mass penetrating several layers of tissue. So typically, most of the time, you're going to see a mass. It could be a lesion, either or. Diets high in smoked food, those high nitrates, or if you like your food charcoal, the black all over it, decreased amounts of fruits, vegetables, all of these things will increase your risk for stomach cancer. Risk factors: gastritis, gastric ulcers, hereditary, H. pylori. Any kind of decreased hydrochloric acid promotes bacterial growth, and that can be a strong indicator as well. So if you have something that is decreasing that hydrochloric acid, you're actually creating an environment where bacterial is able to kind of spread and grow and be bigger. And we already talked about those diets. So signs and symptoms: a lot of times it's a prolonged feeling of fullness right after eating, anorexia, weight loss, anemia, melena, and pain. All of those can be pain can be a very late symptom. So hopefully they've come in and talked about it before then. Treatment: the only curative treatment is going to be surgery, removing that spot, and they'll probably also have to receive chemo and palliative radiation. So radiation, chemotherapy, and surgery. The chemo that they typically use is called 5-FU and adriamycin. 5-FU, they actually take that home on a pump, and then they have to come back a couple of days later and get the pump removed. So it really is pretty extensive treatment as far as chemo goes. Surgical treatment depends on, of course, where the ulcer or the tumor is. They can do a partial gastrectomy where they're going to remove part of the stomach. Right here you can see where they removed part of it. And then they joined it up to the duodenum, or remaining portion could be joined to the jejunum as well. So it depends on where that cancer spot, that tumor was. A total gastrectomy is going to be removing the whole stomach. And so the esophagus is going to be joined up to the jejunum, and usually it's going to be a gastric malignancy. With this one, because you've removed the entire stomach, you are no longer going to have that intrinsic factor. Remember, it puts you at risk for pernicious anemia. So they will actually need B12 injections to help absorb that. No secretion of the intrinsic factor absorbs vitamin B12's. Levels are going to decrease. The body does have some natural reserves of vitamin B12, so injections will begin about 1 to 2 years post-op. Okay, so you'll work off the reserves, and then eventually they will need some B12 injections. Post-op, you'll have an NG tube, and you will see initially some of the blood in the contents for about the first 24 hours, but you shouldn't after that. And we know that anytime when you see, when you go through, period where there is no bleeding, and then all of a sudden there starts up some bright red bleeding, we know that that is a very bad sign. That means it's fresh bleeding, it's a new bleed, and so we have to be on top of our game for that one. Call the doctor and let them know that immediately. We're going to be monitoring their vital signs, their level of consciousness, their eyes and nose, and all their labs. Typically what we could see with this complication of the gastrectomy, where they removed all of that stomach, would be dumping syndrome. Okay, so they take out that entire stomach, and now you basically just have your esophagus tubed up to your small intestine, your jejunum. So typically what dumping syndrome is, it occurs after meals. It's increased when fluid is consumed with meals and too many carbs. So if a person is taking in a lot of carbs, or if they're drinking, even just having a drink with their meals, we can see this. And what happens is that stomach empties really, really quickly. All that fluid is drawn into the small intestine. Blood is shunted to the intestine, causing hypovolemia, so they start dropping their blood pressure. It will cause weakness, dizziness, sweating, palpitations, abdomen cramps, and diarrhea can all occur, and it's really, really quickly. If the syndrome progresses really suddenly, and you have a lot of carbs, it can stimulate the pancreas to create too much insulin, and then that would of course cause hypoglycemia. It would cause your blood sugar to drop, and so you'd be hypoglycemic. Ways that we kind of help with dumping syndrome is we're going to teach them to lay down after meals to slow digestion, lay them on their left side, and then tell the patients not to be drinking with their meals. Don't take any fluids with them. Wait in like 30 minutes and then afterwards get a drink or something. Now that is if they are actually taking in the fluids themselves. If for some reason they have to have a tube and we're giving them tube feeds, we do need to dilute that actual solution a little bit. So we'll give them a flush beforehand, we'll give them a flush before afterwards as well. And the reason behind that is because formula or the tube feeds, it's so concentrated that whenever it gets to the gut, it just kind of makes it shoot on through. It kind of, it's too concentrated, but adding a little bit of water, a flush beforehand and afterhand will help decrease that. Okay, that's all we have for that one.